Good morning, everyone. I'd like to welcome you to New Brunswick Lung NB Lung's 31st Annual Respiratory Health Symposium.
Our next speaker this morning is Dr. Sanjeev Sirpal. Dr. Sirpal is an emergency physician, public health and health policy enthusiast, lawyer, and research with a diverse professional portfolio. He serves as a staff attending physician at Edmundston Regional Hospital, where he plays a vital role in various intra and extra hospital committees. His commitment to advancing healthcare extends to his active participation in the New Brunswick Medical Society, NBMS, where he serves on the Health Policy and Promotion Committee. Additionally, he serves on the Cannabis Harm Reduction Committee, which is a collaborative effort between NBMS and NB Lung. His research and policy interests are centered on improving healthcare accessibility, enhancing healthcare performance, and promoting evidence-based health policy creation. And we're very interested this morning to hear Dr. Sirpal present on navigating cannabis, the health impacts, harm reduction strategies, and policy pathways. Welcome, Dr. Sirpal.
To share, is everybody seeing my screen?
Yes, we can see your screen now. Absolutely perfect now. Yes, you can proceed.
Okay, wonderful. Good morning, everybody. As I was introduced, my name is Sanjeev Sirpal. I'm an emergency physician in the Vitalité Regional Health Authority, Zone 4. It is a sincere pleasure to be with you this morning. Today, we're diving into a topic that rapidly is gaining relevance, which is the effect of cannabis consumption on respiratory health. For my francophone audience, je vais faire la présentation en anglais, mais si jamais à la fin de la présentation, il y a des questions en français, ça me fait plaisir de répondre en français.
I can speak English, so if you want to ask your questions in French, that's okay. I can speak both languages.
In many parts of the world, healthcare professionals are increasingly encountering more patients who are using cannabis, whether that's in the acute care environment, which is the environment within which I work as an emergency physician, or even in more of a chronic environment where patients are presenting with respiratory symptoms related to their cannabis usage. This brings unique challenges, particularly in understanding the impact of cannabis consumption on respiratory health. And I believe it calls for an evidence-based approach to harm reduction and policy. So today's presentation will cover three principal areas, which is first, the cannabis effects on respiratory health, two, harm reduction strategies, and three, broader health policy implications. So without further ado, let's start by looking at some key trends in cannabis consumption. Currently, cannabis is the most commonly used illicit drug worldwide, with over 200 million users. And if we look at North America, legalization has fueled significant growth in usage, particularly among younger adults. In Canada, the usage of cannabis surged following its legalization in 2018. The most common consumption methods for cannabis remain inhalation through either smoking or vaping, which we'll discuss later on, although edibles and oils are also growing in popularity. The shift in consumption pattern underscores the importance of understanding the different health impacts associated with each method. And here we see in the graphic that's presented here from Statistics Canada that there is a rise of cannabis consumption that's progressively been seen over the past years in Canada. So now if we look at so this was a slide, actually, sorry, I think there was a little bit of a delay in projection of that slide, but this is a slide that looks essentially at the global and North American consumption of cannabis, and the infographic that we see here on the right, which is also from Statistics Canada, shows the usage by province. And we see that there's quite somewhat of a heterogeneity in different provinces insofar as cannabis usage is concerned. And here in New Brunswick, we're sitting at 18%, which is somewhat on the higher end of the spectrum, ranging from 11% all the way up to 27% based on these data, which were from the first quarters of 2018, 2019, and the fourth quarter of 2020. So it's a bit dated, but this is from the National Cannabis Survey. So now, if we look at cannabis smoke consumption and composition, cannabis smoke, it's often anecdotally perceived as less harmful than tobacco smoke. Oftentimes, even we as healthcare professionals somehow may perpetuate this notion that cannabis is healthier when it comes to in comparison head to head with tobacco. But the reality is a bit more nuanced than that. Both cannabis smoke as well as tobacco contain harmful chemicals like tar, carbon monoxide, and ammonia. Cannabis smoke, much like tobacco smoke, also releases harmful combustion products such as polycyclic aromatic hydrocarbons, PAHs, which are known carcinogens have been studied in the literature to be known carcinogens. Furthermore, the cannabinoids in cannabis, such as THC and CBD, interact directly with both directly and indirectly, I should say, with respiratory tissues, which can be linked to inflammation. So inflammatory processes going on in the lungs. So the key takeaway here is that while cannabis and tobacco smoke have different primary ingredients, both expose users to similar toxins from a respiratory perspective. And what I'm presenting here is a very recent, very interesting table that was published in 2020 that looks at chemical composition of cannabis smoke insofar as it pertains how it compares to tobacco smoke. And we see that surprisingly, a lot of the hydrocarbons, a lot of the known carcinogens are actually higher in cannabis compared to marijuana. So the blue is marijuana, the red is tobacco. And we see that in many instances, some of these hydrocarbons are higher in cannabis. So it just underscores the notion that it's a bit somewhat of a myth to say that cannabis smoke is less harmful on a respiratory basis compared to tobacco. Now let's move towards respiratory symptoms in cannabis users. One of the most immediate consequences of cannabis inhalation is the development of respiratory symptoms. Studies have shown that regular cannabis smokers often experience symptoms that are similar to chronic bronchitis, including cough, increased smoke production, and wheezing. There was a large meta-analysis that was published in 2018 by Gassamiesfe et al. In 2018 that showed that there was a higher incidence of chronic bronchitis among daily cannabis smokers compared to non-smokers, and that difference was statistically significant. And what's particularly important for us as healthcare providers is the need to recognize these symptoms and educate patients on the risks associated with chronic inhalation of cannabis. Here on the right, we see a very interesting graphic that was published in 2023 in a very interesting paper that showed that cannabis smoke and its derivatives not only can cause we're now beginning to understand it's no longer considered somewhat of a black box where cannabis smoke causes respiratory illnesses. We're now understanding a bit of the molecular nuances where cannabis smoke may in fact activate certain inflammatory processes and inflammatory signaling pathways, including different cell types that are shown here that can be indirectly and directly related to inflammatory as well as infectious, as well as even sometimes neoplastic processes in the respiratory system. What about cannabis and pulmonary function? There's been considerable debate about the long-term effects of cannabis on lung function. Some studies have shown that occasional cannabis use does not significantly impair pulmonary function, while heavy use can lead to lung hyperinflation and airflow obstruction. For instance, there was a landmark study by Pletcher et al. In 2012 that showed no major decline in pulmonary function in occasional users, but the jury is still out when it comes to chronic heavy users. These findings highlight the need for further longitudinal studies to better understand how chronic cannabis use impacts lung health. And why is this important? It's because oftentimes what we see in healthcare as healthcare providers, what we see are not the occasional the patient that comes with the occasional usage here and there of cannabis, oftentimes, and because of its growing popularity, because of its legalization, we're often seeing patients that are essentially chronic users. And being able to understand that, first of all, pulmonary function can be affected by marijuana smoking is something that can inform a lot of our discussions with our patients and can help us educate our patients in the appropriate manner. Here in on the right side of your screen, you see an article that was published in 2023 in chronic obstructive pulmonary disease, which shows that on a temporal basis, when you look at there is an actual decline in post-bronchodilator forced expiratory volume over time by marijuana consumption. And it's based on, they're looking at marijuana joint years, which is somewhat of a new concept, especially when we look at pack years when we're looking at tobacco consumption. So this is an area of research that's gaining more and more popularity as we're trying to understand the nuances of how cannabis can have a decided impact on pulmonary function. Now let's talk about lung cancer risk. And the summary really is that the jury's out. There's conflicting evidence. One of the more controversial topics is just that, is the relationship between cannabis and lung cancer. Cannabis smoke, as I had mentioned in a previous slide, it contains many of the same carcinogens, many of those same polyaromatic hydrocarbon compounds that are found in tobacco smoke. Many of them are also found in cannabis, and in some instances, we're finding even higher percentages of those PAHs, those dangerous hydrocarbons that have been linked to lung cancer. We find them in some cases even higher in cannabis smoke. However, the studies have not definitively shown a strong link between regular cannabis smoking and lung cancer. One of the possible reasons for this could be the lower quantities of cannabis smoked compared to tobacco. Tobacco has been legalized and has been popularized and in mainstream culture for quite some significantly longer compared to cannabis. So that could be one of the factors that's related to why we don't see that strong link. However, given the presence of known carcinogens in cannabis smoke, it would be very prudent to consider the potential for lung cancer risk, especially in heavy long-term users. And this is an area that definitely requires further research, but it can inform, like I mentioned, it can inform a lot of our discussions that we're having with our patients insofar as when we're advising our patients related to cannabis consumption and the risks for further long-term consequences, including lung cancer. Here we see some images in COPD. There's been actually even a term from a radiological perspective in radiology speak known as marijuana lung. So we're now seeing changes on CT scans, chest CTs that are compatible with chronic marijuana consumption. So I find this exciting because this is we're developing more and more of a clinical tool set that allows us to understand the direct as well as long-term consequences of cannabis use. And the ultimate benefactors of this research is our patients. We're able to better inform our patients. We're able to better educate our patients so that we can advise them of the risks associated with cannabis consumption insofar as respiratory health is concerned. What about vaping? Vaping has often been promoted as a safer alternative to smoking, but the evidence is very far from being conclusive. While vaping reduces exposure to combustion byproducts, it is not without its own risks. The recent outbreak of what's been termed E-Valley, which is the e-cigarette or vaping product use associated lung injury, has highlighted serious respiratory complications associated with THC containing vape products. So now when we're looking at patients who vape, which is a lot becoming more and more popular, especially in our younger patient populations, we should be aware that some of those same risks still apply, and in a different set of risks apply to those set of patients. As of 2019, the Centers for Disease Control reported over 2,000 cases of e-vaping, product use associated lung injury, or e-valley, with many linked to contaminated vape products. And this is only in the United States alone. And so this underscores the need for caution when patients consider switching to vaping as a safer option. Just highlights the importance to understand not just the quantity of cannabis consumption, but also the mechanism, the means in which it's consumed. And like I mentioned, vaping is not without its own risks. So now that we've talked a bit about the effects of cannabis on respiratory health, I think it's prudent to really frame this discussion in terms of harm reduction strategies. So from a public health perspective, harm reduction is a key principle when it comes to managing cannabis use, particularly among patients who may not be ready or willing to stop. We encounter this on a daily basis, not just in terms of cannabis consumption, but with other substance use. Encouraging non-inhalation methods, such as edibles, oils, or tinctures, can significantly reduce respiratory risks. But that doesn't mean that those other forms of consumption don't come with their own risks. But since our discussion today is really focusing on respiratory health, understanding that different mechanisms of consumption of cannabis have different impacts on health can really inform our discussion with our patients. Additionally, counseling patients to reduce the frequency of their use, or to consider, for instance, water pipes or other filtration devices to remove certain of the polyaromatic hydrocarbons, can help lower exposure to those harmful byproducts and therefore the sequelae associated with the consumption of those byproducts. And as with any other harm reduction strategy, the goal isn't necessarily abstinence, but rather to minimize harm while respecting the patient's choices. So we have to understand cannabis is legalized, but our role as healthcare professionals is to provide guidance to our patients so that they understand the risks associated with consumption of cannabis, and they can modify their behavior appropriately, provided that they're given the correct information and most recent information so they can make informed decisions as to insofar as their consumption is concerned. Public health education and the role of providers. As healthcare providers, we play a very crucial role in educating our patients about the potential risks of cannabis use. Many users are unaware of the respiratory issues associated with smoking or vaping cannabis. I can't tell you the number of times in the emergency department when I see patients that sort of have this notion, and it's potentially somewhat has started to change with a lot of the public health campaigns related to cannabis use. But they're of the impression oftentimes that cannabis use is without the same risks that comes with tobacco. It's almost risk-free. It doesn't have any sort of dependency associated with it. So it underscores the fact that many users are unaware of the respiratory issues associated with smoking or vaping cannabis. So using patient-centered techniques and being able to borrow on the wealth of literature that exists in, for instance, motivational interviewing, that can be highly effective in discussing these risks without alienating or stigmatizing our patients. A lot of our patients have grown to become, to incorporate cannabis in their daily routine. So being able to understand those risks adequately, have a discussion with the patient, even in an acute care context, such as the emergency department, can be highly effective in really making a positive change in patients' lives. It's essential that we approach these conversations with empathy. We focus on the patient's health goals while providing clear evidence-based guidance on harm reduction. And, at the end of the day, it's also okay to say that the jury is still out in certain areas. And while there suggests that there is a risk, sometimes we don't have all the answers because the area of research is still nebulous. It's still in development. There's still lots of research going on and lots of research to be done to understand those risks. But arming our patients with that knowledge allows them not only to be better informed, but allow them to make better choices for their own respiratory health. Now let's look at the legal aspect of things. So cannabis legalization and health policy. So here in Canada, this has been really a very it's a very timely topic because we've essentially been a laboratory for understanding how substance legalization, insofar as cannabis is concerned, how that has led to changes in consumption patterns and in public perception. And it goes without saying that the legalization of cannabis has led to significant shifts in public perception, with many viewing it as a safe or a benign substance. However, legalization often focuses on the regulatory and economic impacts. And we have to understand that legalization and public health impacts are two different things. A substance can be made legal, but does not mean that its public health impact is negligible. For example, regulations around product labeling, THC concentrations, and public education on health risks remain inconsistent. I firmly believe that as healthcare professionals, we must advocate for policies that address the full spectrum of cannabis-related health issues, including respiratory health, to protect our patients and the broader community. Here in today's presentation, I'm focusing on respiratory health, but I'm underscoring the fact that the impacts of cannabis go far beyond respiratory health. They have impacts on various different systems. And I think it's important as healthcare providers to be aware of such and being able to advocate for evidence-based policy making that addresses that full spectrum of cannabis issues, cannabis-related health issues. So what can we as healthcare providers do to influence cannabis-related health policies? First and foremost, I believe that we must advocate for evidence-based policy changes. This includes supporting regulations that mandate accurate labeling of cannabis products, particularly in terms of THC concentration and potential respiratory risks. Additionally, we should promote research into the long-term effects of cannabis use, especially as more potent forms of the drug become available. Lastly, we can integrate cannabis discussions into smoking cessation programs, ensuring that patients who use both tobacco and cannabis can receive comprehensive support. And sometimes it's not a one-size-fits-all approach. Sometimes patients go to tobacco for a certain reason, and their reasons for incorporating cannabis may be different. They may use it as an anti-anxiety medication, self-medication. They may use it for pain control. So understanding and approaching those conversations in a very respectful manner is something that I think is incumbent upon us to do as healthcare providers. And then looking beyond the individual patient that's before us, but looking at what are some things we can do as healthcare providers in terms of policy recommendations. It allows us to be more engaged in those discussions and be better advocates for our patients right now and in the future. So I'd like to close the presentation with a quick case study. So let's look at a typical case that I'll speak from my own experience working in the emergency department, where I often confront patients that have daily cannabis consumption. So here we have a 35-year-old male who comes in with a 10-year history of daily cannabis smoking. He presents to the ED with acute respiratory distress and wheezing. And I think what we've really learned, and I hope what's been disseminated in this presentation today, is that our role as healthcare providers is to, first of all, in an acute care context, our priority is to treat the acute episode. But we also should try to engage in those discussions, much like we do or we should be doing with tobacco usage, with other substance usage. Even in a very busy acute care environment, we should be able to initiate those discussions. Furthermore, we should be able to have resources at our disposal that would allow us to really inform our patients related to smoking habits, its impact on pulmonary function, and the ability to introduce harm reduction strategies that will have a decided impact on their healthcare. So what's important here is to recognize the role that chronic cannabis smoking has played in the symptoms that the patient has when he or she presents in an acute care context, and I mentioned here the emergency department, but it could very well be in any other context. A thorough patient history combined with a discussion about harm reduction and potential alternatives to smoking can help manage the patient's symptoms and reduce future health risks. Before we wrap up, let's recap some of the key takeaways for healthcare providers. First, cannabis inhalation, whether through smoking or vaping, poses significant respiratory risks. As clinicians, we need to be equipped with the knowledge to address these risks and educate our patients. Second, patient-centered approaches like harm reduction are crucial when discussing cannabis use. And lastly, we should continue to advocate for comprehensive, evidence-based cannabis policies that prioritize respiratory health. By staying informed and engaged, we can help our patients make safer, healthier choices. In conclusion, cannabis consumption, particularly through inhalation, presents a range of respiratory health risks that we must address in our practice. Harm reduction strategies offer practical ways to help patients minimize these risks, and ongoing advocacy for stronger health policies will ensure that public health keeps pace with the growing cannabis market. As I mentioned, legality and studying the public health impacts of a substance are two different things, and we need to be able to keep up with, from a public health perspective, as healthcare practitioners, we need to be able to keep up with the growing cannabis market. I encourage every one of us to continue these conversations with our patients and within our professional circles to ensure we provide absolutely the best care possible to our patients. I'd like to open the floor now for any questions or discussion. Please feel free to share your experiences or any insights you have regarding the harm reduction strategies we've discussed today. I think it's really important to ensure we're supporting our patients with the most up-to-date and evidence-based information available. It's been a sincere privilege to present this to you today.
Thank you, Dr. Sirpal. That was very interesting. We do have a couple of questions coming up. The first question is, how do you assess the risk of secondhand smoke, and they are referring to cannabis smoke, from a neighbor who smokes very close to you, such as when you're out camping? And is there a law that could prevent smoking outside when the smoke is breathed in by neighbors?
I think those are great questions. First of all, when it comes to asking about assessing secondhand smoke, I think we still have to figure out what's the best way to find equivalencies of exposures when it comes to a secondhand smoke situation, and that goes from beyond just looking at, for instance, tobacco smoke, but it can cannabis smoke, but it can also be looking at from tobacco smoke. Oftentimes, we can document that existence, and we can, in our questionnaire with our patients, we can discuss the fact that they're exposed to secondhand smoke. But being able to really quantify that can be a challenge, and I think that same challenge transgresses when it comes to cannabis usage as well. However, the flip side of that, I would say, is that on history, if we have a notion that there is, significant secondhand exposure to cannabis, we can initiate those discussions looking at pulmonary function tests. We can look at, for instance, investigating further whether it goes towards imaging, or what it may be, going towards more of a symptom-directed approach based on the patient's presenting symptoms. So I thank you very much for that question. The second question I believe you had was related to the the regulation when it comes to that. And I think those are exactly the kinds of discussions we need to have. Just like we're having discussions and we've had policy making when it comes to secondhand smoke and not being, individuals not being allowed to smoke around public places, things of that nature. As we understand more and more of the risks associated with cannabis consumption, insofar as respiratory health is concerned, I think we are the champions for that change. We are the ones who are going to be able to document those risks, be able to have those discussions with our patients. And then when it comes to policy making, having evidence-driven policy. So further research will be able to also demonstrate having that evidence-based policy making will allow us to make those changes when it comes to laws, when it comes to regulations, so that we reduce the risks when it comes to primary as well as secondhand smoke consumption. So I think that's an excellent point. I think there is a space for laws related to that matter. Are we there yet? I don't think we're there yet, but we should continue working towards further research and being able to be advocates for that type of change.
Thank you. So we don't have any other questions. So I'd like to thank Dr. Sirpal for your time and for being here with us today.